Welcome to the Advancing Surgical Care podcast, brought to you by ASCA, the Ambulatory Surgery Center Association. ASCA represents the interests of outpatient surgery centers of every specialty and provides advocacy and resources to assist them in providing safe, high-quality, cost-effective patient care. As with all of ASCA's communications, please check to make sure you are listening to or viewing our most up-to-date podcasts and announcements.
Hello, and welcome to the Advancing Surgical Care podcast. I'm Mandy Hawkins, the immediate past president of the Ambulatory Surgery Center Association, or ASCA, and host of this recording. My guests today, who will join me in just a moment, are Bob McSweeney, president of Emerging Market, and Emmy Augustine, director of health policy for Ganey Associates. I've asked Bob and Emmy to join me on this podcast to discuss the outpatient and ambulatory surgery consumer assessment of healthcare providers and systems, or as we call it in our ASC community, OAS CAHPS, or OAS CAHPS, a postoperative patient survey that was developed by the Centers for Medicare and Medicaid, or CMS. Bob, Emmy, and their team are part of an affiliate relationship with ASCA, and they are the point of contact for our ASCA members who are using Ganey's OAS CAHPS survey tools. Until now, the OAS CAHPS survey has been a voluntary in the ASC quality reporting program. But starting in January of 2025, OAS CAHPS will be a regulatory requirement for all Medicare certified ASCs. Failure to comply would cause a 2% reduction on the Medicare fee schedule for delinquent ASCs. Ganey is one of more than a dozen survey providers that have been approved by CMS, and they have been working with a number of our ASCA members who have wisely started to comply with OAS CAHPS ahead of the January start date. To learn more about the OAS CAHPS progress being made by some ASCs, as well as the imperative for all the others to get started, I've asked Bob and Emmy to share what they have learned so far. So Bob and Emmy, welcome to the ASC podcast.
Thanks for having us on.
Bob, for months, ASCA has been advising its members to select their survey provider and begin implementing their OAS CAHPS surveys now rather than later, because like any new system, there's an integration period and a learning curve for our staff and our patients. How long are you finding it's taking an experienced ASC administrator to become familiar with Ganey's web-based reporting platform and adequately train their staff with its use?
Thanks, Mandy. I would plan on a 2 to 3 month setup process, and that's really just to get the survey process going. And that includes survey customization, that includes IT connectivity. And we hold our ASCs hands when they're doing this implementation. And I mean that not literally, but figuratively, we hold their hands. And I've spoken to many, many ASCs over the last 6 months. And what I've found is that this is going to replace the existing surveying that they're doing. They're not going to do both. And so what's nice about that is it's really repurposing the investment they currently do with either an internal process, which is very laborious. They're handing out surveys and they're collating the data and they're trying to, quantify the qualitative data they get back. It's really, really hard to do that in a manual way. Or they're using another vendor that's not CMS certified and they're just migrating that process over to us. The web-based reporting platform, once they are set up and running, it's really user-friendly and very intuitive. And we have tons of training materials for them to get up and running. And I will say to your first point in terms of getting started, we are built for scale at Ganey. We get back over 5 million surveys every single day from our clients. And we're worried about the fourth quarter, and there's going to be a setup queue in the fourth quarter. And so even if you don't pick Ganey, I hope you pick Ganey. But even if you don't, pick somebody as quickly as possible, because if we're concerned about a queue, the other vendors who aren't nearly our size and have our capacity are going to be in an even tougher spot.
I'm worried for you. You said that some of the centers are choosing to step away from the patient satisfaction and just doing the OAS CAHPS. But if they want to, they can still do both and pull that data from both surveys. Is that possible?
Well, what our clients are doing is we're administering both official and unofficial surveys. And so it's both OAS CAHPS. It's just we're only sending the official data over to CMS on their behalf.
Okay. Makes sense. But they can still ask their own questions if they want to add them into the survey.
They can customize the survey by adding some questions, but the survey's pretty comprehensive. What I am recommending, though, to folks is there's one open-ended comment at the end of the survey. And open-ended comments are so helpful when you're trying to figure out, like the numbers point you into areas of excellence, areas of opportunity from a patient perspective. But the comments oftentimes give context to that if you can look at it in a trending way. But what I'm recommending is maybe adding one other open-ended comment that basically just says, is there anybody at the center you'd like to recognize?
Nice. I like that.
Yeah.
Bob, a number of ASCs have experienced some difficulties and frustrations with the survey tools. And I'm not only talking about Press Ganey. We know other providers are receiving the same feedback. I think it's partly due to the length of the survey at 34 questions. I think we all feel it's a little too long and has some nuanced requirements of collecting the data. How is Press Ganey responding to these challenges of what, and if anything, can be done to ease the process for ASCs who still need to come on board?
Well, unfortunately, the survey is the survey. It is what it is, but we work really hard so that patients and their families understand the process. Our average response rate is 25 to 35%, and that's for the OAS CAHPS survey, right? That's not for a shorter version of the survey. That's OAS CAHPS. And we customize the survey in a couple of ways. One is the survey and the cover letter is going to have the logo of the ASC on it, and someone from the ASC is going to sign that cover letter. So it looks and feels like it's coming from the ASC. We're just administering it on their behalf. We'll be providing marketing material. We're refining that right now. We've already been doing that for HCAHPS and other CAHPS programs where an ASC will send it to them and they can just put their logo on it and it becomes a poster and they can hang it up in different waiting rooms with CMS approved language in terms of explaining what the survey is. They can also take that language and put it into a discharge packet with another way to let patients and their families know what's coming. In our reporting platform, one of the things that you talked about was the length of the survey. It is a very comprehensive survey and there's a lot of data that comes back. And what we're really good at is taking vast amounts of quantitative and qualitative data and making it actionable and so it really helps our clients not to be overwhelmed by that amount of data. We really narrow their focus if they're going to try to improve. And we can tell them exactly where they should focus their attention and their efforts.
Yeah, Press Ganey has a very robust reporting system. Are there different ways our members can kind of navigate how to learn to read and understand those reports?
Yeah, we have a number of different ways. Like there's just a tutorial that's online, and we've done some vignettes actually for ASCA specifically, where they would have access and say, all right, if you want to create this report, boom, here you go. There's a lot of just pre-made dashboards that they will have access to. But like 3 buttons and they can create a comment report that just has positive comments for the previous week. I feel like those commercials where it says it's so easy a caveman can do it. Every time I'm playing around with that, I feel like it was meant for me. I should be in those commercials.
Well, that's good to hear. Bob and Emmy, we need to take a short pause to hear a few words from our podcast sponsor. Stand by and we'll be right back.
This episode of the Advancing Surgical Care podcast is brought to you by AmSurg, a national leader in the strategic and operational management of ambulatory surgery centers. AmSurg partners with more than 2,000 physicians and health systems and more than 250 ASCs operating in 34 states. Learn more by visiting amsurg.com.
Emmy, let me bring you into the conversation. At ASCA, we have heard more than one member who thinks it would be less expensive for them to absorb the 2% reduction in Medicare reimbursement than incur the cost associated with contracting with a survey vendor to collect data from her patient. Personally, I'm concerned that if a significant number of ASCs fail to comply, CMS will impose a much harsher penalty. That aside, what can you tell our listeners about the cost of implementing OAS CAHPS in comparison to the 2% reduction in Medicare reimbursement?
Thanks, Mandy. So what we're talking about is just taking the 2% hit rather than complying with the OAS CAHPS requirement. But there's a little more to consider here, right? So first is your financial impact of that 2% reduction. Of course, can depend on how much you rely on Medicare payments and the services that you provide. Also, the cost of implementing the survey, it can vary too. And Bob has already mentioned this, but many centers, you're already conducting some form of patient surveying. And if that's the case, you'll be shifting some of those resources towards meeting the CAP standards instead. But I think it's important to sort of step back too and think about your reputation and strategy, right? So the results from OAS CAHPS, they're going to be public, which CMS does to help patients and other stakeholders make informed decisions. And not appearing in those reports or appearing with footnotes could really make you stand out, and not in a good way. Another element we need to think about is that CMS, they're working on star ratings based on these surveys. Missing out on a star rating could be meaningful to patients on down the line. And you mentioned the risk of harsher penalties from CMS if compliance drops. It's hard to predict exactly what CMS might do to strengthen their regulations, but they have a history of evolving their standards to push for better care quality. So while skipping on the survey might seem cheaper in the short term, you've got to remember what you might already be spending on surveying today while considering the long-term cost, right? So we're talking about potential reputational damage, future financial risks, and regulatory changes. And engaging with OAS CAHPS, it isn't just about compliance. It's about investing in your center's future competitiveness and leveraging patient feedback for ongoing improvements.
And I would say, to Emmy's point, for most places, this is repurposing an investment they're already making.
I agree. I definitely want to stand out in a good way. I don't want to be red flagged on any report.
Absolutely.
For all of my centers. So, I want to be clear that despite ASCA's concerns about the length of the survey, as well as our objection to the usefulness of some of the questions, we do believe that OAS CAHPS survey can still produce some valuable data for individual ASCs to assess patient satisfaction and for the entire ASC community to demonstrate patient preference for the care that we provide, particularly as we compare the patient experience to other healthcare settings. Emmy, can you talk for a moment about the ways in which you believe ASCs will ultimately benefit from this requirement?
Yes. And first, let me say I hear you, and I am glad that the association is engaged with CMS and the Agency for Healthcare Research and Quality, so your government affairs team and your leadership in providing feedback on the survey. So that's important. But despite these types of reservations, I would say that the survey is really beneficial for ASCs. So firstly, there's the fundamental value in asking for feedback. So when patients see that we value their experience and feedback, it builds trust. So just the act of asking for feedback builds trust. Then that feedback, the data, it allows centers to identify areas where you can enhance patient experience, build loyalty, and drive overall reputation. And the data also enables ASCs to benchmark against peers and others, including hospital-based facilities, and to help identify best practices. And you can show concrete evidence of positive patient experience to consumers, to your community, to payers and regulators. And collectively, the data helps the ASC community, the association, demonstrate the strengths of the ASC models, to support your efforts and the overall message that you want to tell with policymakers. So, despite some of the challenges, perhaps no survey instrument is perfect. The survey is a tool for improving care, and an important one to help you with your benchmarking of your performance and really reinforcing, as you mentioned, the value of ASCs and the overall healthcare landscape.
I love that you focus on the reputation and the benchmarking, because those are both things that all of our ASCs definitely look to.
That's great.
Well, Bob and Emmy, I want to thank you both for spending some time with me today and for all you and your colleagues are doing to help our ASC community comply with this new regulatory requirement. This concludes our podcast discussion. For any ASCA member looking for additional information about OAS CAHPS or other ASC-related issues, please visit the ASCA website at ascassociation.org.